Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Hi everyone. Today we're going to talk about Tamex, a medicine that combines betamethasone and Loratadine. This medicine is perfect for treating allergies and inflammation. If you suffer from hay fever, hives, or other allergic reactions, Tamex can help. It's also useful for allergic asthma or atopic dermatitis. And how does it work? Well, betamethasone is a corticosteroid that fights inflammation and redness. Loratadine, on the other hand, is an antihistamine that relieves annoying allergy symptoms like itching and sneezing. Normally, the starting dose is 1 tablet a day, preferably in the morning. It's super important to follow your doctor's instructions and not take more than indicated. Try to take it at the same time every day so it works best. Like any medicine, Tamex can have some side effects. The most common ones are sleepiness, dizziness, and dry mouth. If you notice anything strange or that worries you, don't hesitate to talk to your doc. Important: if you have an infection caused by a virus or fungus, don't take Tamex without talking to your doc. And as always, tell your doctor about any other medications you are taking to avoid problems. To sum up, Tamex is an excellent option to treat different types of allergies and inflammation. Remember to follow the instructions carefully and have good communication with your doctor. Thanks for watching this video. If you have any questions, ask your doc. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.